IVF is a form of what's called assisted reproduction, which basically means that you are placing a woman on medication to make them produce multiple eggs. So typically you produce like 1 egg a month, but when you go through IVF, that it's advantageous from a success rate perspective to have produced multiple eggs. So they're on medications to produce multiple eggs. We remove those eggs and we fertilize them with their husband's sperm, either naturally or with a process called ICSI, intracytoplasmic sperm injection, where you inject a single sperm inside of an egg to allow fertilization to create an embryo, and then transfer the embryo back into the womb of the woman.
In the past 3 to 5 years, we've been using micromanipulation much more than before. There's been a lot of improvements in the technology for testing embryos. And basically micromanipulation is something that we can grab the embryo with microtools and perform an embryo biopsy, which is basically removing a few cells out of the embryo. So around that stage, they have around 100 to 150 cells. So we can remove 3 to 5 cells without affecting the baby. And then we can send those cells out for genetic testing so we know if the embryo is normal, so it's free of genetic disorders. So by doing this, we can transfer a single embryo with a much higher chance of that embryo implanting and becoming a baby.
The success rates with IVF have increased tremendously over the past 10 years, really. And so IVF has been a very effective way, it's highly successful, of achieving a pregnancy. When you place women on medications to stimulate their ovaries, you don't have control over the number of eggs that they release, and so you're at risk for triplets or more in terms of medication, and so IVF allows you to have some control over that because you're producing embryos and you're transferring a single embryo in their uterus.
With IVF, we can know 100% if those eggs get fertilized. With insemination, we can't. So success rates with IVF can go as high as 70%, transferring a single embryo, compared to about 18–20% for inseminations. It's definitely a big improvement, knowing that every time that we transfer an embryo, we have such a high chance of pregnancy that we give hope to the patients.